Nanotechnology, which is very, very small technology, can be used to engineer particles that can carry drugs specifically to the cancer, thereby avoiding healthy tissues and healthy cells and reducing adverse side effects in patients. You can have much better efficacy of those drugs because they're accumulating in the tumors much more effectively, and thereby you are ensuring that you get a much better response in the patient, both in terms of reduced adverse side effects, but also enhanced treatment responses. The nanoparticles that we make will typically be around 80 to 100 nanometers in diameter. And to give you a context of how that fits into something that you would understand on a daily basis, a single human hair would be 100,000 nanometers. So nanotechnology could transform the way that doctors treat patients in the future, because we can engineer nanoparticles so that they can be loaded with the drugs and be targeted to the tumors, thereby avoiding healthy tissues. That would be really cool. Actually, that would be really cool. So you could take the iron oxide nanoparticles that right now can be used with MRI to really quickly detect a cancer and show the presence of cancer that you might not get with normal detection methods or current detection methods. And then you package that with the drug that you need to deliver in a formulation that goes to the tumor preferentially. And as the tumor is being treated with that drug, you're also at the same time able to monitor the cancer getting smaller and watch it being treated. And that would allow you to determine whether you need to provide more drug. It would allow you to be able to determine whether the disease has been completely treated. It would be a really, really promising approach to new therapeutic approaches in the future. One of the major factors that allows me to develop these wide range of therapies is graduate students. And the reason I bring this up is when I have the graduate students in my group, they come here as new students that have just completed an undergraduate degree, and they're about to embark on a whole career of investigating. And one of the great privileges and the great joys of my position is I get to mentor these students, and they get to explore all of these different ideas and strategies for improving the responses to diseases and making therapies work better for treating diseases. The graduate students are the reasons that we are able to make so much progress.